I have to ask everybody to move closer. It would be nicer. I mean, if you can, it would be a little bit more intimate because we're really a small group. I'm hoping that as people meander back here, but then usually I say that I don't have to yell so loud, but I think that I cannot use that as an excuse here today. So thank you very much for your interest in diving deeper into telehealth and telemedicine. I hope you had a great breakout session. I think it was a wise choice to actually take a break from telehealth, let it sink in a little bit, do something else, and then come back. So thanks for being here. And so I gave you the high-level overview of the opportunities and obstacles, and now I want to make it operational, basically, if you will. What's the treatment plan here? How are you going to implement that in your clinic? I'm going to go through a lot of materials, but you have access to the slides here. You can use it. And what I intend to communicate here is to make it for you a blueprint of how can you use this in your organization to stimulate thinking, to organize your thinking. I know that having worked with physicians a long time and in healthcare, there's a different operational mode than we engineers like to think about things. Physicians make quick decisions and there's a lot of repetition. But this process that I'm sharing here with you has evolved over the past 10 years that I've worked on it, and every time I learn something new and I add something to it. And my biggest concern from day one that I start working with an organization or think about telehealth and telemedicine is organizational change management. And Dr. Beeson talked about this, and I just cannot overemphasize that. That is what derails and what can derail the telehealth effort if you don't pay attention. So all of these things are really, truly designed to help you with that organizational change management, to identify the why and to get people involved and get them engaged and have it in a structured way and in a systematic way that is different. I'll talk about defining the workflow first before you pick the technology, which in many other cases that's been done the other way around. The other thing that I'm excited about in telehealth, as I mentioned before, is that we have a unique opportunity to redesign how we want healthcare to be delivered. We've been at the mercy of the government of telling us what to do. We've been at the mercy of technology vendors telling us how we should talk and interact with our patients. And because the EMR was designed for billing purposes, not for facilitating a great patient-physician relationship. So we have a unique opportunity to take kind of in this window here to take the reins into our own hands and say, wait a minute, if telehealth is really the healthcare delivery of the future, if in the future it is true that most patients will interact with us at a distance using technology, what do we want this experience to be like for us, for our clinic, for our practice, for our urologists? And therein lies the great opportunity, and that's why it's important that you take a moment of going through the steps. This is not a 6-month effort where you need where 3 MBAs will be harmed in the process, or 2 MBAs, 1 MHA. This is something that you can do in quick succession, especially if your organization is not that large. A lot of the things here, you just need to give it some thought, write down some bullets, and it's really the process that you go through. It's the journey, as they say, that's the experience, and that's the one thing that's more important. So let's get started. The topics that I have here for you are the why, the what, the how, and the who. So how do you define a telehealth strategy? How do you develop your business plan? What are your workflows and technologies? How do you go about developing those? And then how do you set up the launch and the support teams to help you do this in the right way? Just going to skip over the slides here. Telehealth, delivering care at a distance, and practicing medicine at a distance. And we're going to see them again. And as I mentioned in my talk, but I don't think I had the slide up here, it is not about the technology. It is about the workflow, defining who does what, when, where, and how. And it's about managing the organizational change. If you have just organizational change and workflow, you have inefficient progress because you're not taking advantage of technology. If you have technology and a workflow, but you're not managing the organizational change, you have failure or unfulfilled potential in that maybe a few people are using it, but it's not scalable and it's not sustainable. It'll fizzle out because it hinges on the energy of key individuals, but really not everybody is engaged. And then if you don't give any thought to the workflow, but you manage the change really well, then the team is very disciplined, but otherwise you have chaos. And it's when you have all three elements together that you truly have success. So why do we need a telehealth strategy? Well, you've heard the quote before here: if you don't know where you're going, any road will take you there. A strategy is defined, the purpose is to identify the why you're doing it. Dr. Beeson talked about the storytelling. What's the story that you want to tell? What's the story of your practice in 10 years with regards to telehealth and telemedicine? Answering that why is the first step into actually managing organizational change. It's motivating people to think about why they should be supportive and be involved in creating the future of healthcare through telehealth and telemedicine. What you need to create success is you need continuous executive support. So if you're in a leadership role, providing that support, providing that leadership, providing that vision, owning that vision for telehealth is key and important. And then that change management. And then the other point that is very important, you need to have a disciplined and a very structured launch. I just got a question from a gentleman here who wants to start telehealth. They're part of a larger multi-specialty clinic group, and some other internists have been using telehealth successfully, making revenue, getting paid for it. So all is going well. And so he asked me the question, well, how should I get started? And I said, well, what's the simplest thing that could possibly work? Start there. That's good from an organizational change management perspective because you get some early successes, but it also helps you to really identify within your organization, within your unique scenario, how can you launch this in a structured way. If you start with yourself or with a small group, somebody who is engaged, you get an early win. And then over time you will figure out what is the right approach to scaling this. And you only have one chance to make a first impression was the first idiom that I learned when I came to the US 20 years ago, and it stuck with me, and that's really ever so important with change management as well, because if you fail, people will remember this for a long time. I have been to organizations and said, have you done telehealth before? Oh yeah, it doesn't work. I said, okay, why not? Yeah, we got a grant in '98 and we had a card. I think it's somewhere in the closet now and it's not working. I said, well, it's 2017. I said, why do you say telehealth doesn't work? I mean, so people, organization memory is very much there, and people will pay close attention. So choose your battles wisely, so to speak. Choose the ones that you can win in the beginning. And that's what the telehealth strategy does. It really focuses on that continuous executive support so that it's owned by the leadership team and that you can manage the change by really going to the why. So the recipe is you need to create a vision for your organization. What does telehealth mean for our organization? Why do we want to use it? Make it about the patients. Why will patients be better off? Because that's always a good business model if we think about our customers first. And we don't traditionally have done that in healthcare, but I think over the last 10, 15 years that has changed. You want to link to your strategic plan. You want to really tie those two together. And I have yet to see a strategic plan of any healthcare organization where I couldn't, for each strategic objectives, could list at least 2 or 3 different telehealth services that would help them to move their strategic objectives forward. So don't let that. So this is another way to make your strategy come alive. A lot of organizations have challenges. They do this annual retreat. They come up with a one-page PowerPoint slide that has all the strategy on there. They assign organizational owners for the different branches of their strategy, but then they fail to operationalize it. This is a great way to operationalize your strategy in saying, yeah, we're going to achieve those things that we set in our strategy by using telehealth and telemedicine, and this is how we're going to do it. A great tool to prioritize. And then you want to create a roadmap. You want to give those people who are visual, so I mean really a visual roadmap, you want to give them some idea of what's going to be happening over the next year, over the next 3 years, the next 5 years. So they kind of know what's going on, and that everybody kind of has an idea of where this is going. So it's not just a one-time effort, like for example, like an EMR conversion or so. This is much bigger and much more exciting because we're redesigning how we want to deliver healthcare. How do we want to interact with our patients? How do we want our patients to get better more quickly, have better access to us? If you need some inspiration for your vision, you can just look at the quadruple aim. How will telehealth help us to improve patient satisfaction? Do we have insight into our patient satisfaction? How will we achieve better health outcomes through our telehealth strategy? How will we lower the cost of care? And the only answer that I already have, how can this improve provider satisfaction, is how can we design the services in a way, the workflows in a way that this truly helps us to improve provider satisfaction, allowing physicians to practice at the top of the license, to focus on the areas that they are really motivated around, that calling that was mentioned early this morning. How can we design a process, a system where physicians can find or rediscover their calling and have that experience on a daily basis to do so. And then you can take this slide as inspiration as well. So take a look at what are some examples. Interactive patient care. You can have telemedicine follow-up visits, so you don't have to patients just come in for the results of their biopsy. You can have remote patient monitoring, post-surgical. You can have maybe there's some opportunities within your practice for store and forward. You can have education portals, you have patient engagement apps, so there's multiple ways to do that, and it depends on initially the interest of what's feasible in your organization. So you can look at what maybe the competition is doing, you can get some inspiration of some of the things that I mentioned here, but the best way to get started is where are there some passionate supporters around the telehealth and telemedicine, different services. And then you can look at those outbound services, which are listed here on the left, and then also the inbound services. So the opportunities to bring in telehealth, telemedicine expertise to your patients if that is a scenario that makes sense in your unique circumstances. So this is a brainstorming tool here. So once you have the vision, you know where you're going, you know the why, and you've got a link to your strategy, then the next step down is to develop a telehealth business plan. And here, it's not really about the plan itself, but it's rather about the planning process and engaging the key stakeholders, engaging the key influencers. So if you have people that are on the fence about telehealth or that have some resentment or that have some concerns, and physicians are not shy, so you will know about those, then you can involve them. You said, okay, here, help us with your voice, with your critical thinking, help us to make this better. What are your concerns? And oftentimes that can be a way to do it. Sometimes it's the underlying causes they have checked out, that there are some other things going on why they don't want this. It's another change that they can sabotage, so to speak, and it has nothing actually to do with telehealth. So there's some underlying organizational issues, and then you need to help from somewhere else. But it's not about the plans. It's not about creating a 3-ring binder to end up on the CEO's shelf. It's not about creating a 5-pound printout of a nice business plan, or make this a term paper or thesis of an MBA or MHA degree. So it's really about the process. The template that I'm using, and some of these chapters might just be half a page, might just be a few paragraphs, but the first thing is the organizational assessment. What's the culture within your organization? How adept is your organization to change? Do you have a history of good change initiatives over the past years, or have they been challenging? And so do you need to invest more in making sure that this particular change effort does not go down the same path as some other change efforts? What's the interest there within your organization? What exists maybe already? What are people already doing? Or maybe they've been exposed to some other telemedicine, telehealth in the past. The second one is then the environmental assessment. What's the situation in your state, with your payers, in your city, in your county? What's going on there? What are you seeing? What are you hearing? Talk to the telehealth resource centers, see if they have some insights, can connect you with some other people that may be doing it in a different state, or network here at this event with individuals, get some inspiration for some ideas of what's been working. I'm going to recommend to LUGPA that maybe a survey should be crafted to go out to everybody. So again, you can learn much more from each other than any external resource can provide. We can provide the impetus and be the catalyst, but you have a lot of great examples that have already been brought to my attention here today. And that's where I think an organization like LUGPA is really great. As was said in the opening statements, networking is one key, and that is one aspect of networking, is to facilitate the exchange of what is working for you in your urology practices, and look at those best practices across telemedicine. And that's part of the environmental assessment as well. And then what's your organizational change management approach? How will you do this? How do you establish governance? How do you measure progress and process? Depending on the size of the organization, this may be something just added to some other governance structures, responsibility to just capture the dashboard that performance is going well. But larger organizations who may launch different types of telehealth services, there you would establish more governance structure. So this can be one sentence, or it can be 3 paragraphs. Telehealth support, how will you support it from a technical perspective? And that might be just your existing IT support, but also then from an operational perspective, and what operational support are you anticipating, and where would that live? So defining those aspects are key. And then what's your roadmap for the telehealth services? Where do you want to go? Do you want to go interactive patient care? Do you want to go remote patient monitoring? Do you want to go teleeducation, patient engagement, patient portal, those kind of aspects? And then, like any business plan has a first set of services or products that you're going to launch, your business plan is going to have a first set of telehealth services, or maybe just one telehealth service that you're going to launch, and that's what you're focusing on. What are the marketing principles? How do you currently market to your patients about the availability of offerings, and what can you tie into there? Maybe you have some other updates that are coming down the pipe where you want to communicate with your patients. Can you piggyback on that? Financial analysis. Is this going to be financially feasible, or are we okay with having this maybe a write-off, but we see some downstream benefits from that? Are there some other environments like an ACO where this makes sense, or maybe ACOs are these days still very primary care focused? And then risk analysis and mitigation. What can go wrong? What can happen here? What are some other initiatives that we're working on? What's the risk, for example, of some legislation coming down the pipeline? So all of these risks, just giving it some thought. And so this very easily can be developed with some concerted effort, can be developed within a couple of weeks. But it provides a great guidance, and it provides a lot of exposure to so a lot of people get exposed and get involved in the planning effort for this telehealth service, for the telehealth program, which again is part of my approach to ensuring that the change is managed appropriately by engaging people, by giving people a voice, so that they have some input. So once you've got the business plan, the strategy, now, okay, let's think about the workflows. And here's where my approach differs from a lot of other decisions that have been made in healthcare IT. I highly urge you to first define the workflow. Sit down with the right people and define, okay, how we're going to do scheduling, how we're going to synchronize the workflows. How do we know that the patient is ready? How would you know the physician is ready? What happens if the physician is not ready? What's our contingency plans? What's our backup plans? How do we want to deliver healthcare in this new environment where the patient doesn't have to come in? So we have a unique opportunity to take a step back and say, yeah, how do we want this workflow to work? And you do that before you select your technology. So you take a look at what are the peoples and the processes that we have. So who is doing what, when, where, and how. The best way to start is actually mapping your current workflow, which has tremendous benefits because it provides for the first time people an insight of what other people in the practice are actually doing. We had the example this morning that the physicians do not know the names of the receptionists. But a lot of physicians, especially at the Mayo Clinic, don't know all the effort, for example, that went into getting the patient there into the room. And those of us who work on the fringes know what all the amount of effort that goes into that. And then what happens after the patient leaves the exam room. So understanding this whole process and just having a mental map of what's happening and then saying, okay, so this is not, so now we take the patient out of the clinic and we put them in the home or in a nursing home or wherever they are. How's that going to change? And how do we want this to work? What would be ideal for us? What work do I want to do as a physician? What work should we have our MAs do? What work should we have our receptionists do? Do we need to create a new role like a telehealth coordinator or telehealth concierge that brings the patient online? So that's where innovation happens, and innovation happens in that structured environment when you look at the different steps of the process. And so doing that is a valuable exercise which actually will unmask and will discover inefficiencies in your current process that you can easily change and fix that have nothing to do with telehealth and telemedicine. So the return on investment of that time is really great. And again, you're contributing to organizational change management by getting people involved and engaged. Specifically, if you pull the slide up here a few months from now when you're going through this process, if you're looking about interactive patient care here, the video-based, you want to look at what's the process for scheduling, what's the process for synchronizing your patient with your physician, and then what are all your contingency plans. If the technology fails, the patient does not show, the physician is delayed, if there's an emergency, so you interact with a patient and suddenly there's a big boom noise and there's some smoke, and so what do? I mean, do you call 911? And so having these things thought through is important. For remote patient monitoring, you basically go through this five-phase process. You enroll the patient and train them. You set up the equipment at their home. Then you have the monitoring. If there's if the vital signs come back in the way that they're outside the parameters, then you want to escalate it and intervene. And you need to have a process for that. And then you want to recover the device. You want them to send it back. You need to clean it and then send it back out again. So that's the basic kind of framework for how remote patient monitoring works. It's quite a few steps and a lot of work. I'm working with an organization through that right now, but the vendors can also help to some extent there. Okay, so now we have the workflow defined, and now we're ready to really start looking at technology solutions, because now we're armed with the knowledge. We know what we want. We know what we're looking for. We know what kind of workflow ideally we would like to implement and what kind of experience we would like our physicians to have, and how many steps how many hoops they need to jump through, how many steps they need to complete. We know we have defined what our patient's experience should look like, and armed with that knowledge and that deeper understanding, we can much more quickly assess whether a solution is a good fit for our organization or not. Oftentimes you go through who you know, who you met, or maybe there's a vendor who's been bombarding you with great newsletters for the last 3 years, and you finally invite them and they give a great sales presentation and then they made the sale. But do you know if that's the best solution or not? Similarly, you have EMR technology, and the EMR vendors are adding telehealth capabilities, which in my assessment, the ones I've seen are rather clunky, especially on the patient end. Technologically they work, but it's about the workflow, as I mentioned in the slide earlier. And so every healthcare organization is different, and so what experience, do you want your patients and your users to have? So you need to have usability, reliability, and security, obviously. There's hundreds of vendors out there in all different areas, and so the standard selection criteria that I recommend here, they're pretty obvious, is does it meet your needs? Is it a sustainable business? As I think mentioned earlier, there's about $6 billion venture capital flowing into digital health startups this year alone. It's not all telehealth, obviously, but I think the first quarter it was $170 million into telehealth startups. And so there's a lot of money flowing in. That means that in a few years there will be mature solutions looking for buyers, trying to sell, and then the pressure will come also from the patients. Or as other organizations are adopting that. And you want to be prepared for that, but you also want to bet on a horse that's going to be in there in the long run. So you want to look into how are they funded, what's their exit strategy. So you want to have somebody look into the more details of what's happening there, so that you can make sure that you are betting on technology that will be around. And then they have fair pricing. There's been a lot of telehealth deals in the past by the bigger venture capital funded companies. They were very aggressive because in the beginning, venture capitalists didn't understand healthcare, and they thought they could get the same turnaround as another technology-driven startups. And so they thought they could get a 3-year exit, a 4-year exit. In healthcare, it takes 7, 8, 12 years. But venture capitalists was very aggressive, driving, no, you need to make sales. And so that led to some very unfair sales agreements that the healthcare organizations somehow got themselves locked into, and then realized that they're not reaping the benefits. So make sure you get a fair pricing on that before you decide on a vendor. Because the technology has really greatly evolved. 10 years ago, it would have been 50-60% of my effort in telehealth was on the technology and making sure that it was well managed and was reliable and usable, and it was very expensive to buy. But nowadays, we have a great reliability and high usability. They're most cloud-based. They're relatively inexpensive for free, at least for some of the systems. There's still some hardware component, and there's still some vendors out there who price themselves very at a very high price point. But they're being replaced by new entries into the marketplace. And so this is just a snapshot here of some vendors that I've studied a little bit more closely for a client engagement last year. And then this is a map, a matrix I put together here. So basically, what's the completeness of their telemedicine vision and their ability to execute, to perform, to cost effectively. So down here we have the visionaries. Those are the ones who have a great vision, but they can't really execute yet, and it's not cost effective. Down here, that's the crowdest field. Most crowdest field is the niche players. And as I mentioned in my earlier presentation, it's really about the specialization. So I can absolutely foresee that there will down the pipeline here in 5 years, there will be urology specific solutions that talk about certain aspects that are germane to your specialty. And so there's an increasing specialization around that. Sorry, wrong button here. And then here we have the challenges, the ones that are very cost effective, but they don't have a complete vision yet. And then here we have the leaders. Now I did get the question, and so to be proactively addressing that is the reason why I blocked out these names well, the main reason is that I don't want to get sued by any of the vendors who are not on the list or who feel that they should be on the different, because I didn't apply a really thorough research analysis. Also, as I mentioned, I based this on the Gartner Group's Magic Quadrant, and so I don't get permission on that. So right now it's just a matrix. But if we get together and you want some insight, and it's not very hard to figure out who are the 5 here, and I can share those 5 in a conversation here. But yeah, it's a moving field, and there's consolidation happening and a lot of different things in here. But it's important to have some guidance, to have somebody to help you navigate in that market to help you figure it out. All right, so how do you then support telehealth during the launch and then ongoing for the support? What I recommend here is that you establish a multidisciplinary team. So you need to really have different people with different expertises. One is project management, And then the other one is workflow design. So somebody who's experienced with workflow design in a clinical practice environment is very key if you really want to take advantage of the opportunity to redesign healthcare. And then also some telehealth technology expertise to help you to evaluate whether this is a good fit. Although the more work you put into defining your own workflows and identifying your needs, the more suitable you are to really make that assessment. It's very critical that we have clinical input and clinical expertise. I highly recommend, urge organizations to have always a clinician in charge of the telehealth overall program and the governance to really have that owned, because telehealth is not about the technology. Telehealth is about healthcare delivery, and healthcare delivery is about clinical expertise, and so it needs to be physician-led. It cannot be technology-led or administratively led. It's very important. But then on this multidisciplinary team, you also need then the operations expertise because still there needs to be support that needs to be provided. Here's a nice blueprint for how you can think about designing a telehealth service. So what we've talked about before here was the overall program. So assuming there's multiple services, maybe RPM, IPC, maybe under different scenarios, different payers, different interactions. And so, but for each service, the process I go through is first making the case for it. So the strategic case, the business case, and the clinical case. What do I mean by that? Business case is obvious. That's the financial model. How do we get paid for that? How does it make sense financially to do so? The strategic case is how does this particular service help us to implement to realize our telehealth strategy, and by extension our organizational strategy, because we got them linked. And then the clinical case that is very important is that we have the clinicians buy-in, that we really have the clinicians say, yes, I can deliver the same level or even a better level of care through telemedicine, or using telemedicine will allow me to deliver a better level of care. Maybe, for example, with remote patient monitoring, we will have insight into the patient's condition even though when they're not in the clinic, and that's something we never had before. And so we can derive from that it makes sense that the outcomes, the clinical outcomes, the health outcomes will be better. Now, armed with the validation that yes, okay, we need to have go into the design phase. We need to design the workflow. How's this going to work? How's the scheduling going to work? The interaction, the follow-up, everything that's involved. And then we can select and decide on the technology that makes sense. Then think about how do we operationalize it? How do we start it? That's the proof of concept. The purpose of a proof of concept is to validate your assumptions. So the first thing you need to do is you need to become aware of all the assumptions that you're making. We're getting reimbursed, we can get paid for it, patients will like it, patients will know about it, our physicians will like it, we can support it, technical support will be minimal. So whatever all the assumptions that you made during that planning process, make them explicit. Then look at, have a table, make a next column. Okay, how we're going to measure that? Patient satisfaction, provider satisfaction. So you measure all of these metrics during the proof of concept only, and then you launch the proof of concept using what's the simplest thing that could possibly work as your guidance. Launch it, start measuring, start improving, making changes to the workflows, maybe some tweaks to the technology, tweaks to the communication with the patients, tweaks to the education of the people involved in the workflow until you get it right, and then you start scaling it up. You involve more physicians, you involve different patients with different conditions or whatever your scalability parameters might be. And then before you do that, you think about the organizational change. Okay, now that we're rolling this out to a bigger group, what education do we need to provide? Do we have to have a CEO, have a pep talk with everybody, and then roll it out? So here you have a very clear, structured blueprint of making sure that when you decide on a telehealth service and you develop it, that you're following it in the right steps. And the biggest thing is that you really, independently of what technology is available to you, you first think about the workflow. Now, you still may make the workflow fit for your technology solution that's available to you, But then it's a conscious choice. It's not a given. And you can maybe even influence the vendor to make some changes or some modifications, customizations, if that's possible. So that's very key. Here's some different revenue models. So direct-to-consumer cash pay is one model. One scenario I think that is important in urology is men's health, or anything that has to do with our bodily functions that the people are embarrassed to bring up or to go to a clinic to. And so does maybe accessing expertise, getting some advice, getting a consult over the web with or without video, maybe just text, does that remove some barriers? Can we reach more patients? Can we address those people who are suffering because of their condition, but can we reach out to them? And that's where technology can be a great enabler, because it just makes it a little bit more anonymous. There are a certain group of psychologists that psychiatrists and psychologists that I've worked with that have said that for certain conditions with certain patients, the patients are actually sharing more when they're in a telehealth visit than when they came into the clinic. I was just presenting at a Psychiatry in the Mountains conference in Tennessee, a group of psychiatrists, and there were numerous psychiatrists who were at the beginning on the fence of telehealth. It's not going to work. I need to see the patient. I need to feel them. And they became converts, saying that, there's a lot of opportunities. And so especially if it becomes a sensitive topic, that's where telehealth can remove that barrier of having to travel and sitting in the waiting room. And especially if you're in a smaller community, everybody knows that Mrs. Smith went to the urologist today because I saw her car in the parking lot. And so those are things where technology can help. Reimbursement then. We have Medicare, yes, with limitations. Patient needs to be in a rural county that is not designated as a metropolitan statistical area, and patient needs to be actually located in a clinic for Medicare reimbursement, meaning in a rural clinic, in a nursing home, in kind of a clinic site. That was put into place in 2001 because the Washington bean counters were concerned of spending way too much money. They thought that we're going to have to reimburse $25 million in the first year, because if you open up the floodgates to everybody, then everybody would just be staying home and just be constantly calling the physician from home. That is still not the case, as we've now seen. And it actually took them 7 years to reimburse $25 million. So from 2001 through 2008 or 2007 that's how little reimbursement was actually done. And 25 million out of the CMS budget cannot be, is probably less than budget dust. I mean, it's a little speck. But unfortunately, this was put in the statutes, and so it takes an act of Congress now to change that. CMS is trying really, really hard to work around the fringes with innovation models with different states, with bundled knee replacement, for example, explicitly permits telehealth, telemedicine. They are now doing at least remote patient monitoring codes here. So there's 4 new codes coming out, or 3 new codes. So now there's 4 codes for remote patient monitoring, for the setup, for the ongoing monitoring, and for chronic care management. And so they're finding ways, and they're seeing the benefits. And as more research is also being done with that researchsociety.org, searchsociety.org, the Society for the Education and Advancements of Research in Connected Health, then we will see more validation of that. For Medicaid and commercial insurers, a lot of them are reimbursing at the same rate. You simply submit the same billing code with a modifier. For most, it's the GT modifier. For some, it's the 95 modifier. Just ask the payer. And a lot of commercial insurers are now offering it, or more and more commercial insurers are offering it in states where there's even no parity law. There's still some states that only have a coverage parity law, meaning you need to offer payment, but it doesn't have to be at the same level. But other states also have a payment parity law. And so, again, you need to look into the details. Unfortunately, in the fee-for-service environment, that's just still where we are. With regards to telehealth support then, You need to arrange for operational and technical support, especially if the service is not used very often or also infrequently. You need to make sure that the people who only get involved in it from time to time have access to educational materials. And but the key lies in a very well-designed workflow. And if you design the workflow well and you had everybody involved, then actually there's very little support that you need. Telehealth should never be organized as a central function or central department, so to speak. It should be owned by every specialty, by every group that is using it, and so because it's really part of healthcare delivery. 3/4 of all problems are related to training or lack of training or forgot about training or didn't remember or training wasn't very clear. I often have laminated cards next to the telehealth unit, just a quick cheat sheet, or it could be an intranet page, something to quickly refresh your memory. Whatever you have as a help desk or some technical support, they can have a top 10 list of common problems that they can quickly troubleshoot. But in most cases, rebooting the computer will do wonders. Technical support comes a little bit more tricky if you're doing direct to consumer. So if the patients are at home, they have an app. There's so many different technologies out there, and having a workflow that really helps the patient to have a good setup before they get online with the physician is also very key to make this efficient. And contingency plans are key for technical support, so that you have to find what you're going to do if something goes wrong. So those are the 4 elements here. You have a telehealth strategy, a business plan, define your workflows and technology, and then you have launch and support. Putting that together, another visual here, just to use to putting it all together on one page, is how you can depict it with the strategy, the business plan, the methodology, and then launching those different telehealth services. The resources that are available to you, I've listed here. The telehealth resource centers, they are grant funded by HRSA, a 3-year grant that just renewed a year ago. And so they have consultants available for free to you for a certain number of hours. Every telehealth resource center does their own different little programs, little events, newsletters. So if you're interested in telehealth medicine, get engaged with them. And that's where you can get some help. And you can see the map here. And then the American Telemedicine Association is a trade organization that has an annual, or actually two events a year where you can really browse a lot of the vendors. If you really want to get started, that's where sometimes I've taken clients as guided tours of the exhibitor floor, because there's so much to navigate. You can use consultants, and obviously the vendors also the better vendors know a thing or two about how to implement this in the right way and have it as part of their package, as part of their startup cost with you embedded. And with that, I want to thank you again for attending. And if are there any questions? I take a look at here. Those were from an hour ago, 2 hours ago. So, and I addressed, I think, any recommendations for system vendors without knowing what you want to do. No, it's like, what car do you recommend? Yeah, a German car, maybe. And what do you recommend vendors for telehealth? Yeah, same questions. I can. What I do for my clients is I give them options. And I give them said here's the pros and cons of the different vendors, and I just give them enough information to make their own decision. So I'm not a doctor of telehealth. I'm an advisor, and so good. See me afterwards. I'll be around the afternoon here. Oh, there's a question. Yes, wonderful. Yes, thank you.
What I really want to ask is, well, great presentation. We've actually been looking into implementing telehealth in our practice, but we just couldn't find a way to do it, especially within Illinois. So there's 2 questions. One is, how do you structure the direct consumer cash pay? And if we just do that and not, have the patients go through insurance, is that totally legal?
Yes.
It is? Okay. So how do you address, and does the technology have a scheduling feature so that it also ties into like our patient management system? Because right now we use our patient management system to schedule these appointments. You know, how do you structure that?
Yeah, well, it depends on the vendor that you're going with. So in a direct-to-consumer DTC model, there's a number of vendors out there, and some have, in my opinion, sometimes reinvented the wheel, so they provided their own scheduling engine. And the challenge lies there: how do you integrate your scheduling? Because if the resource is the physician, and the physician, the way I like it, telehealth being implemented is that the physician one time sees a patient in person, and then the next appointment maybe a telemedicine visit, and then maybe another one. So some organizations make a telemedicine day out of it, or telemedicine evening, but ultimately I think it'll be interwoven. And if you have that, then the integration of the scheduling becomes a little bit tricky, and I recommend that you then use actually your own scheduling system and modify it to accommodate that. But if you set a day aside where you know that the resources are available, then you can use the vendor's scheduling system. Some vendors do have some scheduling abilities to do so.
Okay, thank you.
You're welcome. Good. I wish you a great lunch, a great afternoon. If you want some information materials, I've got a table out there, and contact me if I can be of any help. Thank you very much.